We know the activists in charge of Canada's drug policy want to push things like so-called safe supply. They don't want dissenting views getting out there. Interesting thing happened in British Columbia when Dr. Bonnie Henry, the province's chief medical officer, released a report calling for full legalization of all hard drugs. They also released another report they'd commissioned that had a different viewpoint. Well, they kind of buried that. Adam Zivo has written about it for National Post, joins us now. Adam, thanks for the time.
Thank you for having me back on the show.
So tell me about this other report. It's by an American doctor named Culkins. Why did they commission this? And then why did they not really have it out there in the public?
So Safer Supply, once again, is this program where they distribute pharmaceutical opioids and other addictive drugs to try to dissuade people from using illicit substances. So, for example, if you're addicted to street fentanyl, the idea is that we give you hydromorphone, which is an opioid as potent as heroin, to dissuade you from getting drugs on the street. The problem here, though, is that there's a pretty significant body of evidence showing that these programs are being widely defrauded and that these free addictive drugs are being resold on the street so people can make money to buy their drug of choice, which is typically fentanyl, which means that we're subsidizing the illicit market, not mitigating it.
Yeah, so we're trying to get people off fentanyl. Instead, we're giving them a way to buy it by selling a different drug.
Exactly. And we're also flooding communities with diverted safer supply drugs, predominantly hydromorphone, because this program is so poorly structured and there's no required witness consumption here. We basically just give you a bottle of hydromorphone and say, we trust that you'll use it as intended. Now, I started to report on the ubiquity of safer supply diversion in May of 2023 and continued to report on that throughout the year and continue to report on that even today. And so in the autumn of last year, Bonnie Henry secretly commissioned a report by Jonathan Culkins, where she asked him to do a theoretical analysis of safer supply, of its potential economic impacts. And what that means is how will that impact, let's say, illicit drug markets? Will we expect, is it reasonable to expect diversion? What would a model of safe supply—
At that point, we already knew diversion was happening.
Well, that's the thing. So she essentially commissioned this to do like a kind of theoretical approach and see whether or not the reports that we were seeing could be justified, from an economic lens, or whether they were consistent with an economic lens. And Culkins, his analysis was, for the most part, was pretty commonsensical. He said that if you're going to give away safer supply, for free or for very low cost, you're giving away an opioid which has a street value for free. So obviously there are going to be some people who are sincere users of safer supply, but at the same time, it would be naive to pretend that you won't attract profiteers who will get this drug, which has a street value, and then resell it on the black market. So he basically said that if you're getting to give it away for free or for very little cost, it's naive to imagine that these profiteers won't be there. And then he detailed the many different ways that this profiteering could occur.
So it's interesting that you say it's naive for people to think this wouldn't happen. I find that so many programs that get abused, the government will say, oh, no one would ever abuse that. And it's as if these people have never met a hustler in their lives. They've never met a street smart person who, I don't know, maybe I just worked with them. I went to school with them. But these are the people, they see a government program, a business opportunity. They say, here's how I'll take advantage of it. And they spot it right away and they do it. And there's always going to be people like that in any program. And yet doesn't matter what government program I've reported on in my career, you point out the abusers and the first reaction of well-meaning liberals is to say, oh no one would ever do that. And then you show them the proof. And in this case, it's a very dangerous drug.
Yeah. I think there's an element of condescension here. I think that some of these well-meaning progressives, they want to save these people, which is understandable, but in doing so, they tend to minimize the agency that these people exert over their own lives, especially if this agency is exercised in a way which looks poorly upon these progressives, right? So I think that it's hard for some progressives to accept the fact that their empathy is being taken advantage of. It's psychologically and politically inconvenient. Now, going back to Culkins' report, he said, for example, that one would expect, street level drug dealers to enroll falsely into safer supply programs, low barrier ones, to procure higher quality, cheap drugs to sell on the black market, and that they could be expected to pay other people to enroll in these programs on their behalf. He said that, some drug dealers could be expected to take their hydromorphone and mix it into their fentanyl to extend their supply and their profits. And what he also mentioned is that it is perfectly reasonable to expect that these safer supply drugs will be trafficked across different jurisdictions because safer supply effectively subsidizes the cost of these opioids, which means that it's much cheaper to acquire where safe supply is, very available. So you would go and you procure safe supply where it's very available and where it's cheap, and then you would resell it in jurisdictions where there is no safe supply or safe supply is tightly controlled. So that means selling it across the province, selling it across all of Canada, and sometimes selling across the world. And we've seen evidence of all three things.
It's supply and demand. Oh, what happens, before pot was legal? What happens when supply was plentiful? The price went down. What happened when it was dried up? Suddenly the price spikes. That's what happens, and that's what's happening with the cost of or the price of a hydromorphone pill. Right? It's going for a buck or two in areas where it's plentiful, and it's going for $10 or more in other areas.
Yep. And what's interesting here is that, he analyzes the difference between a model of safer supply where we give these drugs for free or for low cost versus a model of safer supply where we sell it at the same price that you find on the street, which is essentially just drug legalization. And so in the second model, he says that one could still expect there to be diversion, partially because if the drugs are perceived as being safer because they're coming from the government, that creates a premium, right? So people might want to procure these drugs and then resell them at a higher price because they're perceived as safer. But more importantly, is this idea of, once again, interjurisdictional smuggling. So if you had, for example, all of Canada having a model of safer supply where drugs are sold at the same price that you find on the street, so basically, once again, drug legalization, you increase the supply, you decrease the overall price for everyone, you decrease the risk involved in participating in this market. And what that does is it creates incentives for international trafficking, right? So it would be reasonable for people to buy their fentanyl, their meth, their crack, their cocaine in Canada and then traffic it to the United States or to Europe.
What could possibly go wrong with that? So he took a dimmer view of what British Columbia is doing, what Bonnie Henry is proposing. And this report it didn't get the big press conference. It didn't get the big press release. It quietly put on a government website. And they did cite it in Bonnie Henry's report, but in kind of a weird way. And that has some people claiming that, no, it's not a secret report. And Adam Zivo is a lying liar with his pants on fire.
Well, so I have to admit, I did make a reporting mistake, a pretty serious one. I think it's probably the most serious one I've made in my career so far. I falsely reported that the report was not mentioned anywhere, in the BC government's website or on the drug legalization report. That turned out to be incorrect. There are a few different things. I missed some of the media coverage there because it didn't show up on Google. I did some Google searches for the report, didn't show any kind of government pages. And when I went to Bonnie Henry's drug legalization report to check to see if Culkins' work was cited there, I searched his last name. I only found one instance of it in the bibliography, citing another unrelated paper, and there was no other mention of it in the bibliography. It turns out that they had mentioned Culkins' work by its title without his name in the center of the report and had for some reason omitted it from the bibliography.
So look, I get that it's a serious mistake, but they were trying to downplay this, if not outright hide it.
Well,
So
that's the thing. Like,
I mean, people can quibble with you, and this is for guys like you and I who will question the established Laurentian elite narrative, we have to make sure that there's no loose strains because the activists on the other side will pull on everything and then just try and discredit everything. But if they were citing his work, it should have been in the bibliography of the report.
yep,
If they were citing his work, they should have used his name at the point where they were citing it. they took steps to meaningfully downplay his work. Ergo, they're trying to hide it.
And what I would say here is I think that it is telling that they released this report the same day that they released the drug legalization report. And we need to understand some context here. So Culkins's work was kept so secret that apparently not even BC Premier David Eby was aware of it. So he submitted his report in March, and then the news of its existence was leaked to Eleanor Sturko, who is an opposition MLA. And she, brought this up and everyone was surprised. So EB said in April that he was blindsided. So it seems like she withheld this report from everyone, unless EB is lying, which is a whole different other possibility we could explore. But in April, there was a lot of conversation about what could be in this report. It was very mysterious and there was, a lot of discussion there. And so given the stature of Culkins, I mean, he's a very well-respected drug expert. Given what was in his report, one would imagine that would receive its own press release, its own press conference. Instead, it was just quietly appendage onto the drug legalization report, which makes it very difficult, to find. Basically, you're strategically releasing two reports, only focusing on one, taking all the oxygen out of the other. So there has been, for over a year now, this big debate about how much hydromorphone are we giving out through safer supply? How many opioids are we distributing? Because safer supply advocates will say, oh, diversion can't possibly be an issue because there's only 4,300 safe supply patients. There's such a small population that surely it can't be a problem. But the BC government was not releasing this data. In fact, I spoke with a Swedish drug researcher earlier this year who said that he was trying to get this data from BC and they wouldn't release it to him. So Culkins actually got access to this data, and he discovered that in the 2022-2023 fiscal year, BC gave out so much hydromorphone. They gave out 88.8 million milligrams, which is equal to 11 million or more tablets. To give a sense of what that means, just 3 or 4 of these tablets can induce an overdose in an opioid naive user. The total strength of the safer supply opioids given out that year was so great that, like, we use something called MME, morphine milligram equivalent. It's a standardized unit for measuring opioid strength. So the total MME of safer supply opioids that year was equal to 30% of all of the opioids prescribed for pain-related reasons in BC. So you have, tens of thousands, hundreds of thousands of people receiving pain-related prescription opioids. And then you have
people that are going through cancer treatment, what have you.
Exactly, or surgery. And this tiny population has expanded the pharmaceutical opioid supply by 30%, roughly, which is insane.
I've been saying for a long time, we can't let the activists set drug policy. And over the last little while, Bonnie Henry and a bunch of the others, and we discussed Henry a little while ago, have shown themselves to be activists on this. And they keep saying, no, we need to do more. I keep pointing out the drug deaths keep going up. And every time you come up with a new crazy idea, you say, this will stop people from dying. And then more people die. And that gets pointed out. And they say, well, that's because we haven't done enough yet. We have to do more. This just seems like a bad circle that we're going down the drain on this.
Yeah, and the problem here is that they're not really committed to evidence-based policymaking. Most of the studies that support safer supply are really low quality qualitative studies where basically they just interview a small number of safer supply patients, ask them, do you like the program? Does it benefit you? When the patients say yes, and that they're not—
It gives me free drugs. Yes, I like it.
Yeah, that this is fine, this is great, then that is framed as objective evidence of success. Oftentimes the studies themselves will cite their data limitations within the study, but the activists will then in public frame this as evidence. And then, you have some journalists who will then parrot that, which is irresponsible.
It truly is. Well, thanks for bringing the Culkins story forward in a way that actually tells us something new that we didn't know. If you're not reading Adam Zivo's work on safe supply, on drug problems in the Toronto Centre National Post, I'm not sure why you aren't. You need to watch him. You need to follow him on X. and read and share his work. Adam, thanks so much.
Thanks for having me.
Let us know what you think. Drop a comment down below. Share this on social media. And don't forget to subscribe to our channel.